My name is Lisa and I will be performing the Make an Occupied Bed skill. First, I'll start off by assessing for potential incontinence and checking the chart for any safety precautions concerning movement and positioning. I will then identify the patient using two identifiers, for instance, his name and date of birth. I will once again explain the procedure to the patient, noting that he will be asked to turn on his side and roll over linen. I would then perform hand hygiene and put on gloves, as these are droplet precautions. Once I have my gloves on, I will arrange equipment on a bedside table and draw a room curtain or close the room door to respect the patient's privacy. I would then adjust bed height to a comfortable working position, remove call light, lowering rail on one side of the bed. I would loosen the top linen at the foot of the bed and remove the blanket, folding it to facilitate replacement and minimizing wrinkles. I would then take my bath blanket and unfold it over the top sheet. If the patient cannot help hold the top edge of the bath blanket, I will tuck it under the patient's shoulders. I would then remove the top sheet under the bath blanket and discard it into a linen bag. I would loosen the bottom linens, moving from the head to the foot, preparing for removal of all bottom linens simultaneously, and then position the patient on the far side of the bed, turning him onto his side facing away from me. In real circumstances, I would make sure that there's a side rail in front of the patient that is up, guaranteeing their safety and preventing them from falling off of the bed. I would then fan fold the bottom sheets and tuck the edges of the linen just under the buttocks, back, and the shoulders, making sure that the soiled linen can be removed easily. I would take this chance then to wipe off any moisture on the exposed mattress with a towel and an appropriate disinfectant, once again throwing the towel into a linen bag once cleaned. I would then unfold the bottom sheet lengthwise so that the center crease is lengthwise along the center of the bed, fan folding the top layer towards the center of the bed along the patient. For the purpose of this video, I did not have enough linens, but I would also have a clean mattress pad on the bed under that bottom sheet. I would make sure to miter fold the bottom flat sheet at the head of the bed. For the purpose of this project, I will have the miter fold on a separate video. Typically, I would also place a waterproof pad over the draw sheet and the bottom sheet with the center fold against the patient's side, fan folding the top layer towards the patient. Then have the patient roll slowly over the layers of linen, and then raise the side rail on the working side of the bed and go to the other side. I would assist the patient in positioning on the other side over the folds, loosen the edges of the soiled linen from under the mattress, and remove the soiled linen by folding it into a bundle with the soiled side turned in. I would then carefully discard of this in the linen bag. If wearing gloves, they should be now removed and hand hygiene performed after handling the soiled linen. After performing hand hygiene and donning new gloves, I would then pull the clean fan folded linen smoothly over the edge of the mattress from the head to the foot of the bed. After completion, I would then help the patient roll back into a supine position and reposition the pillow so that they are comfortable. I would then place the top sheet over the patient with the centerfold lengthwise down the middle of the bed, unfolding it over the patient. I would ask the patient to hold the clean top sheet while I remove the bath blanket and discard it in the linen bag. If they're unable to hold the sheet, I would once again tuck it under their shoulders. Then I would unfold the blanket over the patient, making sure that the top edge is parallel with the edge of the top sheet and about 20 centimeters from the top sheet's edge. And then make a cuff by turning the edge of the top sheet down over the edge of the blanket and the bedspread. Finally, I would tuck in the blanket and bedspread simultaneously and make mitered corners neatly at the foot of the bed. Change the pillowcases, which will be demonstrated later on. Return the bed to a low position. Raise the side rails. Attach the collet within the patient's reach. Position the bedside table and overbed table within reach. Perform hand hygiene and document any pertinent information from the procedure. While changing the pillowcases, it's important to note that the nurse does not hold the pillow under the arm or the chin while changing the pillowcase.